Hello, I'm Mario Toneguzzi, managing editor of Canada's podcast. Joining me today is Paula Allen, global leader, research and insights for TELUS Health. Thanks, Paula, for joining us today.
Always a pleasure, Mario.
Okay, let's talk about the latest mental health index results that came out from TELUS. Tell me what the most important thing is from those results.
Yeah, well, unfortunately, this time important is also a little bit alarming. If you know about the Mental Health Index, we've been publishing it monthly since April of 2020. So we've seen a lot of ups and downs, and we certainly have our baseline from 2019 and before. And this month, the report that we published shows the most significant 1 month decline that we have ever seen since we started publishing monthly. And the mental health scores in the pandemic, like right at the very beginning, April 2020, really were significantly lower than in 2019. And actually, at this point, they're lower than they were in April of 2020. So we haven't recovered. We've been, sort of in a holding pattern, but we've definitely seen something noteworthy just over this last little while that unfortunately isn't very positive.
So let's talk about the reasons behind it, what is contributing to this mental health, and I'll use the word crisis out there in Canada.
Mhm. Well, we've seen a decline. We look at a number of different aspects of mental health and well-being. We look at optimism, experience of anxiety, isolation, a number of things. And what we also look at financial well-being. And we found that there is a very strong correlation between one aspect of financial well-being and mental well-being. And that, interestingly enough, is the presence or absence of emergency savings. So when someone has emergency savings, they have that cushion, they have that sense of resilience, and it actually is protective. When they don't have any emergency savings, when they really kind of have no cushion at all from a financial point of view, it actually creates this sort of ongoing low level anxiety, similar to if you don't have social support, it might not be top of mind, but you don't have that safety net of knowing that you can go to someone, and that creates that low level anxiety that continues.
Mhm.
And what we found is of all the different aspects that we look at, again, optimism, isolation, et cetera, we found the largest decline this month in financial well-being and specifically emergency savings. So
Mm.
that basically means that fewer Canadians have that safety net than they did before.
Now, the financial stress seems to be always, when it comes to stress and factors in contributing to stress, financial stress seems to be always the top of the scale, right? Why do you think people are so concerned right now about the financial aspects of their lives? Is it uncertainty about jobs? Is it the uncertainty of the fact that everything seems to be costing more these days? What do you think?
All of the above. Certainly, we've had more work, job upheaval in the last little while than we had 2 or 3 years ago. We have 48% of people worried about the cost of living because even though inflation has slowed, we had major inflation. So the price of things went up and very few things went down. It's just going up at a slower rate. And many people are still feeling the impact of that. And when you have those two things together, if you have, the anxiety of unstable income, or you've lost your job and you have higher prices, then you also have debt. And 25% are saying that their biggest financial worry is debt.
Yeah.
So it's a confluence of things that are making people feel less secure in their finances.
Okay. And what impact when people are stressed out and have some mental health issues like they are having right now? What impact does that have for companies and businesses in terms of productivity, not only from the employee, but also in general for the company, the productivity?
That's a great question. And, anything that is distracting is not helpful for productivity. So if you have anxiety, that is, because of, issues with your overall mental health or well-being, if you have anxiety because of financial situation, if you're distracted because of any other reason, your brain is finite in the amount of energy that's available. And that anxiety takes away from energy that otherwise would have been focused on productivity issues like customer service, volume of work, quality of work, innovation, creativity. So it's very much a business issue and important for employers to understand that they should try to do everything that they possibly can to help individuals through times where there are these anxieties and stressors which comes into everybody's life at some point in time.
Hmm. Now, you mentioned companies, what they should do. What about individuals?
Yeah.
What should they do when they're starting to feel the stress?
Yeah, like so just to even round out the company point of view, I mean, what companies have done is they have benefits that can help people. EAP is an outstanding resource, employee assistance programs, because it provides people with, one-on-one confidential support in managing stressors, but also things that are related to the cause of those stressors. So financial consultations, legal consultations, assistance with information on childcare and elder care. So employers can really, think about implementing that if they don't have it and promoting it very, very assertively if they do. And on the other side, employees need to use it. Unfortunately, one of the things that we hear sometimes is that my situation just isn't bad enough for me to reach out and get the support that's available, from professionals, including EAP professionals, employee assistance program professionals. And definitely do not wait until things are a crisis. If you're feeling overwhelmed in any respect, and you don't need to feel that you're having a mental health compromise. If you're just dealing with the stresses of life, you need to reach out for help and not put yourself through more distress than you need to, and get some practical strategies around how to get through the current situation.
All right, wonderful. Thanks so much, Paula, for joining us today.
A pleasure.
All right, that was Paula Allen, who is Global Leader, Research and Insights for TELUS Health. I'm Mario Toneguzzi, Managing Editor of Canada's Podcast. Thanks for joining us today.